Hello NAAOP members and friends. It's Peter Thomas in Washington, D.C. with our latest edition of our video updates to inform you what's taking place in Washington, D.C. as it relates to orthotics and prosthetics. Exciting news recently in the Senate where Senators Snowe and Senator Wyden and Senator Grassley just last week introduced a companion bill to the House legislation known as the Medicare Orthotic and Prosthetic Improvement Act. The number for this bill in the Senate is S2125, and that is updated and kind of refined legislation from the companion bill that's in the House side, which is H.R. 1958. So we're grateful to Senators Wyden and Snowe and Grassley for introducing this legislation. It's very important legislation for the O&P field. It would do identical things to the House bill, but in a slightly different way. The bill would primarily do three things. Number one, it would say that if you're in a licensure state, and there are 13 states that require orthotic and prosthetic licensure, Medicare will not pay unless you are in compliance with that licensure law. Number two, it would tell CMS, Centers for Medicare and Medicaid Services, to go back to the drawing board on accreditation and to re-look at all of the accreditors that it has designated or deemed to have status as accreditors of DMEPOS items and services, and to make sure that those accrediting organizations are in compliance with another part of the federal law that passed in the year 2000 that requires that the standards for accreditation and certification be equivalent to those standards that are implemented by the American Board for Certification in Orthotics, Prosthetics, and Pedorthics, and the BOC, the Board for Certification International. And third, the law would essentially link provider payment with quality standards and would divide up the orthotic and prosthetic benefit according to levels of skill. It's extraordinarily important legislation, and it's been a long-standing goal of the orthotic and prosthetic field for many years. The American Orthotic Prosthetic Association deserves great credit in working through and getting this bill ultimately introduced in both the House and Senate, and with the support of all the alliance organizations, including NAAOP. The next step is to try to get as many co-sponsors onto the legislation and ultimately pass this bill. And so we're asking you today to go to the web, go to www.NAAOP.org, click on the Legislative Action Center, and write to your congressman and senator and ask them to co-sponsor this important legislation. It'll just take a couple of minutes of your time. It's pretty easy to do through the Legislative Action Center, and we very much encourage you to do that today. This legislation is a real watershed turning point for the O&P field, and it's something that we can all be proud of. If we pass this legislation, we can truly work to eliminate fraud, abuse, waste, and a lot of the things that the federal government is doing to the field through the lens of durable medical equipment can finally be implemented in a way that is sensitive to the needs of the O&P community. So we urge you to do everything you can to support this legislation and get your representatives to sign on and support. Thanks so much, and we'll talk with you during the next installment.